Hello, everybody. Thanks so much for tuning in. Happy Wednesday. Happy summer. It's about the second week of summer. I'm sure everybody's running around, whether you're on vacation or taking your kids to camp or doing different sports. And we have an exciting topic to discuss today. Thank you. First of all, thank you to More Sussex Sports for restreaming or streaming this event. And I'm Dr. Lauren, a physical therapist with Better with Physical Therapy. I have Dr. Miriam here. Also my coworker, a physical therapist, mother of two. I'm a mother of two, runner, and Miriam is a very active CrossFitter. And what we're discussing today is, okay, how to stay active as a parent, as a mother. It gets a little more complicated. And just to name a few reasons, just even taking the kids to camp and all, I'm sure, Miriam, you can attest to kind of the juggle. So without further ado, we'll start our presentation because I'm sure you only have about 20 minutes to listen to this. Okay. All right. So, like I said, I'm Dr. Lauren, a physical therapist at Better with Physical Therapy in the Madison YMCA. And I have Dr. Miriam here. And we're here to discuss the 5 things that no one tells you getting back to running and exercise after pregnancy. So what happened? Why are people getting injured after having kids? There's really no handoff after you have your child. I mean, the doctor did his job, his or her job. You know, the baby's healthy, the mom is healthy, everybody's good. But then at that, follow-up, whether it's 8 or 12 weeks, they say, okay, you're good to exercise. But what does that really mean? So that's where things can get a little tricky. So pretty much people usually go to the internet first. That can be an okay starting point, but now there's almost too much information. So you kind of get inundated with conflicting or just a lot of information and even misinformation. So you really have to check your resources. So a lot of influencers are out there now just being like, okay, this is like what you should do to get back to exercise, or even people are telling you different things. So it's just really frustrating. Also, even after that internet search, you're like, well, my friend ran out of the hospital after having her kid. So, I should be able to do the same. Or even if before you were pregnant, you ran a certain mileage or ran a certain amount, or during your pregnancy. So that's a hard thing to do also, because there's a lot different now, and you kind of have to look at yourself presently and not compare yourself to others. Not only with people that have had children, and this again can be at any age, whether you had kids 7 years ago, whether you're pregnant, whether you're not pregnant, but you have a friend that's had a kid and wants to get back to running. This is really helpful information, so feel free to pass it on to them. But regardless, even if you're not a person or in this situation, anybody that gets injured, it's usually a problem between an intensity and capacity mismatch. Intensity being like how far you're running, how fast you're running or exercising, and how quickly you ramp up that frequency or mileage, and then what your body can tolerate, or the capacity of your body. So again, that's how people usually become patients in our office.
Absolutely. So this presentation, live webinar, will go over 5 basic things. We call them the 5 things that no one tells you. So you may have heard some of these, but we're really going to get into the nitty gritty. So body changes and running. So obviously, after you have a baby or while you're pregnant, your body significantly changes. But people think those changes stop after you have the baby, and then they go back to running maybe a little bit too early, or before they're really ready to accommodate for that new activity, and they kind of ignore all the changes that happened for the last year. So we'll go into all of that. Preparing for old and potentially new injuries. So oftentimes you bring some of the old injuries or just some of the asymmetries in your body after having a baby into the new activity, and they can kind of like rear their ugly head in ways that you wouldn't even really think about. One of the themes that we'll talk about is don't let pain be your guide. So fatigue is a huge red flag of maybe to scale back and work on some fundamental things before you go back into this new activity. What to do before running, so proper warm-up, mobilization techniques, strengthening exercises we'll go over, when you can return to running. So Lauren will go over that it's not only time-based, it's really criteria-based. So what are you able to do in order to support your habit of running? And it's not just like 6 weeks after birth, 12 weeks after giving birth. And how to pick the right team. So we bolded this because this is really where all of this information is most important and can really be applied. So picking your right team means like maybe not an influencer on Instagram, but maybe a medical doctor, a physical therapist, any other part of your team that can really guide you into getting back to what you want to do safely with the right information. So we'll go over in more detail each of these steps.
Yeah, Miriam really hit the nail on the head with all of those. I mean, I think there's going to be a lot of information in this webinar, and we tried to pare it down to 5 things. But obviously, if you have any questions and you want to follow up with us, just email us at hello@betterwithpt.com. All right, so our first topic, okay, what happens to our body like after we deliver a baby? So I'm kind of breaking it down to the different body parts. So you have your muscles. So our muscles function differently. So they don't recover as quickly. And that can be not only because of the fatigue that Miriam was talking about, but just even that there's hormonal changes. So your estrogen drops down back to pre-pregnancy levels, and that's for milk production. And again, even though you're in that like 6 to 12 weeks, whatever the timeline might be, those hormonal changes are still continuing long as you choose to breastfeed. Right. And so everybody's different. So there's not like really a hard end point to, those changes. And again, those muscles are less efficient and a little uncoordinated. So your abdominals and pelvic floor had to elongate to accommodate for like the uterus expanding. And, the organs kind of have to go back to where they were. They had to also accommodate for your baby. So again, like the farther away 2 points are from each other, it's going to be harder to contract those muscles. Also, if you had a C-section or a episiotomy, there's a healing time for that. And even scar tissue can be a complication. Right. So on top of that, your joints are a little more loose. Again, that's hormone related. You had to allow the baby to get through the pelvis so that it had to be able to be more pliable. But again, it lasts for longer than just after the baby comes. And so your joints or legs and, entire body are a little unstable, and then your muscles aren't working. So again, that's why something like running, which is really high impact, repetitive, you're just more prone to injuries. And I don't want this to frustrate anybody. It's just better to be aware of these things. So Absolutely. Like, okay, what do I need to do and what do I need to check out before I just kind of put on my shoes and go?
Exactly. It's like arming you. Probably everyone's heard of this, like, oh yeah, I think my hormone levels are off, or I do have loose ligaments, but that the effect of those things can kind of contribute like day in and day out to an injury if you go back to things too quickly without knowing this, having this knowledge, or doing the work to prepare for those activities. It's like, I always envision it like the iceberg, like you see the tip of the iceberg, But underneath it, there's like
totally there's a lot going on.
Yeah. So it's helpful to know this and prepare yourself to have the best outcome and set yourself up for success in whatever activity you choose to do after having a child. Okay, so your body and running, so changes with running. So we obviously know that there's a decreased capacity for exercise simply based on the fact that you're barely sleeping. So just lack of sleep alone can kind of reduce your tolerance to exercise, not even running, just finding the time or energy to commit to something every day. Nutritional issues, so obviously you have increased caloric and calcium needs. They directly affect bone health and your bone density. If you're nursing, or just even if you're not nursing, there's changes in nutrition. You just had a baby. You're probably not focusing on your dietary needs. That's, specifically, it's probably more about the baby. So those things can affect how you tolerate some activities. Huge emotional changes, family dynamic roles. So you're home all the time. You might have been working outside of the home. Now your focus is on something totally different. Stress in general. So there's a significant increase in the stress hormone, cortisol increase, massive life changes, parental role changes. And also, to go back with the lack of sleep, there's just less time. So, and you simply will have less time and also less motivation to exercise right after giving birth or long after giving birth. So those things, I think we always talk about, like giving yourself grace and not comparing yourself, like running out of the hospital. Like that's, not the expectation. So being aware of all of these changes and how it can affect your ability to run or commit to a new exercise program right away.
Yeah, and I mean, if you're really into running or competitively, I think obviously that's where it goes into getting that team.
Yep.
And we'll kind of talk more about like goal setting and kind of, you know, maybe your first race will be more participation than performance.
Right.
And, you know, and obviously within running and exercise in general, there's like a range. So,
Right.
I mean, again, you can always email us. Those that are tuning in live, we do have a chat. So you can type into the chat. We'll get to the questions at the end, just for the sake of time. But again, like everybody's an individual. These are just some key topics that, you know, people run into, like, you know, with running. So yeah.
Literally.
Yeah. So again, just some key takeaways. So 6 to 8 weeks, again, that's just, it shouldn't be the timeline based. It should be more criteria based. And research has actually shown if you want to really go with a timeline, that 12 weeks is actually like more appropriate, or like, you know, 3 or 4 months. Again, we'll talk about criteria because everybody's different. Again, like I think the 6 to 8 week timeline was based on tissue healing times. And even that can, depending on how old you are, how many kids you've had, what type of delivery you had, these can all vary. So again, we want to encourage you looking at a criteria versus a timeline.
And that could be tissue healing with like a cut.
Right. Yeah.
This is having a baby.
Yeah, exactly.
Yeah. So it needs to be like there's relative to tissue healing.
Yes. And then again, like medical history is important because, you know, you have to think about even those injuries, like in high school, like if you sprained your ankle, you're like, oh yeah, I did roll my ankle that one time. Again, like that ligament laxity is going to be a little more apparent, you know, and so just kind of like going through like, okay, like, and not so you're like worried about it, but it's just kind of like, okay, I maybe need to pay a little more attention in how I do things. And again, like Miriam said, you just have to realize, okay, like I'm aware of these things. And I'm going to have to work smarter, not harder when I get back to exercise or running, and don't let pain be an indicator of like, oh, I'm overdoing, because just speaking personally, I'm like a former running throughout my pregnancy, no issues, and even was able to do a marathon after I had my first child. Then I had my second child pretty shortly after that, and everything fell apart. And so again, like I didn't have any pain. Even as a physical therapist, I felt like, okay, I don't have any symptoms and I'm probably fine. But again, at that time, there wasn't as much information available on this topic. Now it's like the opposite, where there's almost too much. And so it can be confusing. So that's why we're here to discuss this, just to kind of like funnel and kind of filter out the noise a little bit. And again, don't look at that pain or look for that pain or symptoms, but also just like listen to your body. Like, did you only get like 2 consecutive hours sleep last night? You know, probably not a good day to exercise, or pick something else. We'll talk about, you know, active recovery and
more
what that
restorative
means.
Treatment. Right. So the impact of old and potentially new injuries. So we discussed this on the 5 things we're going to talk about, but we'll get more into it here. So like Lauren said, previous injuries often return. So I think she gave a great example of an ankle sprain, how it can correlate to someone that just gave birth. So there's this increased laxity in general of all ligaments. So with that increased laxity, previous injuries are already more unstable. So just arming you with that knowledge, like Lauren said, like, okay, I probably need to do some ankle strengthening exercises or some balance proprioception exercises, knowing that this ankle was sprained in the past. Just repetitive physical demands of childcare. So like being in these weird positions for hours at night, or holding a car seat in one hand and have 25 bags on the other hand. So these are like repetitive positions that you're doing every day, all day long, or through the night, you know, and those can also create some potential setup for injuries in the future. New injuries due to decreased core function. So Lauren discussed that, you know, the abdominals are stretched out to accommodate for the growing baby. So diastasis recti is abdominal separation. We have a video that we're going to put up next in a few slides. And then there's pelvic floor prolapse. So that's an additional injury. So this is all under the umbrella of core destabilization like syndromes. And that can then set you up for potential back pain, lower extremity issues, just things to be aware of so that you know how to address them and develop your team so that you can kind of kick them to the curb and move on to the things you want to do. And remember, just like we said in the last slide, absence of pain doesn't necessarily mean you're ready. So I think you should almost assume, like, hopefully no one has pain, but you should assume that there's a pretty high level of fatigue, and that needs to be really tempered with really thoughtful training. It doesn't mean you can't train, but doing some of these things early on, getting the right help from knowledgeable people, can really set you up for getting to those goals in like an appropriate time frame.
And we treat lots of runners, at our office. We're all Run DNA certified. And so even again, if this doesn't necessarily apply to you, there's ways like, unfortunately, if an injury or having a child is making things more complicated, you end up becoming a more efficient and stronger runner because, there's probably things that you should have been doing. And I even realized I just kind of loved running. I did some strengthening, but maybe not as much as I should have.
Right.
So again, going back, current research says even 3 to 6 months, as if you really want a timeline, and that again, that's an average. Like even if you're functioning, pretty well and you meet those criteria, you could, start running sooner. So that's why self checks are important. So, Miriam talked about diastasis recti, and so there's a way to check for that. So I'm just going to click on this video so you can kind of check how to. And not that you can't necessarily run if you have diastasis recti, it's just information. This is just collecting information. I think with that, whether it's that or pelvic prolapse, which means like the pelvic floor with the hammock of muscles underneath your pelvis, if they can't hold your organs in, obviously these are both very distressing, but I don't want that to be distressing for you. Right. It's plenty of people have these conditions and they can run. Right. It's just more okay, there you have to do a little extra things, or maybe not necessarily extra, but change some things. Right. And again, we'll talk more about that into the running criteria. So also about getting checked out. So it really helps having someone else's eyes and hands on you, and a physical therapist. We're movement specialists. We can not only even if you don't have any of these kind of classic common postpartum injuries or after injuries after having kids, those are previous injuries, or even how you choose to move, we can, pick that up. And that way we can make a guide to safe exercise specifically for you versus just kind of like an online program.
Absolutely. The online programs don't account for your past medical history or how you function day to day, like the postures that you're in, the nutrition you have, how much sleep you have. It's a program that's sent out for the masses, and there's no individualization of it. And that's why a PT or an appropriate team is best.
In case you missed it.
Okay. So what to do before running? So checking your posture. Obviously, we talk about posture a lot, is huge. So there's massive changes that happen after you have a baby. Feeding, childcare demands, just the position you're in. And those positions are usually incredibly uncomfortable. And often we see people come in years after having children, they'll say, oh, I always carry my baby bag on the right side or the car seat. And these are years after having a baby. So they take sometimes a long time to express themselves. Multiple pregnancies close together. Obviously, just by nature, those create a little bit of a situation of weakness. Looking postural daily tests, so washing the dishes, desk work, childcare, obviously. Poor posture, without a doubt, creates a situation where you're more likely to get injured. But poor posture, there's no perfect posture. It's really learning the positions and mobilization techniques and strengthening exercise to create a stronger postural tolerance or awareness. So no one can stay in a perfect posture all day. And to be honest, that wouldn't be perfect because we're meant to move around. Right. So it's really important to find the right stretching flexibility program for you, and being aware that posture is important with all of those things feeding it. Strengthening, mobilization, proper rest, all of those things. So posture is not just perfect posture, far from it.
Yeah. And I mean, Miriam said it the best. I think it's one of those things where you have to think about, what am I doing? Right. And then not only in terms of how that's affecting my posture in general, but how do I function well? So a swimmer is going to have a lot different posture than a power lifter, for example, but they have good, perfect posture for their sport. Right. However, that does set you up for certain injuries. And so as a parent, there is mommy posture and stuff because of these things. But,
what are you talking about?
I know, I was kind of am I sitting up straight? Oops. Okay, so yeah, in the theme of like what to do before running, we talked about screening, check your posture. It's really important to like really look at your running program or your exercise program. So there has to be some sort of strengthening involved. Like, I mean, yes, the pelvic floor and the trunk and hips are going to have some issues, but not only like what you do, but how you do it. So, what happens is a lot of times people just progress too quickly, whether or not they are cleared with those criteria that we'll discuss. But just even like, okay, there's like a 10% rule with running. I mean, that's more of a guideline in terms of like, you shouldn't really increase your mileage up more than 10% each week. That also on top of that, we didn't discuss like there's obvious weight gain during pregnancy. And so your joints are going to have a higher impact going through them. So the AlterG treadmill is a great option. You can see it. We have one in an office. We're one of the few locations that I'm aware of in the area. And so what that is a body weight controlled treadmill. So we get a lot of great information. Yes, you can, it's better than water running because like, we can't change anything. We can't control, we don't get any information. But with this, it's like, okay, we can progress you in a very measured way. We can analyze, okay, are you spending more time on one leg? Is there any like difference between the legs? So, I mean, I think it's just a great, especially if you're training for something.
It's very objective.
Yeah, and then it's like, okay, at least you're still able to run, but in a way that's less stressful on your body. So we talked about, the obvious fatigue and lack of sleep. So, whether it's like, certain other things that you can do like swimming or low impact stuff, but you can also use some other tools such as the Hypervolt, which is a great, wonderful recovery tool. And performance tool for that matter. So it uses percussion or vibration through the head of the device, and you can run that along your muscles. That way it's like a quick way to kind of improve their flexibility and performance in recovery. Also with recovery, we have these Normatec boots that uses graduated compression to assist with blood flow and recovery. These are available in our office, whether you're a patient or not. We have recovery Saturdays. Right now in the summer, we are closed on Saturdays. However, please call us if you're interested because we can either schedule a time, whether it's a weekend or later hours, to have you come in and do a demo.
Okay. So this is a little bit more about the AlterG treadmill, AKA the time machine. So just to go over this a little bit more. So people often say, like, how is it different than water running? So in terms of the feeling, it's the same, but the information, it's similar, but the information that we get is very, very helpful, just as clinicians and physical therapists. So we can see if there's a cadence difference. So if you're using one leg more than the other, if you're putting more weight on one side more than the other, if you are not putting weight on one side, or you're pulling that leg back slower than the other side. It's basically like a computer on a treadmill. There's video imaging. The data from it is really helpful because it's objective. And like Lauren said, we can increase that and follow that 10% rule just by this device or this machine, really. In a pool, you can't do any of that. So you stay the same level of buoyant anytime you go in the pool. This we can slowly increase depending on your training and what you feel comfortable with. Also, it improved that brain-body connection. So oftentimes after surgery, there's a disconnect there. And without some of that intel, so once you see that information on the screen telling you that you put 48% on one side and more on the other side, you can kind of create that connection, and that feedback will help to retrain some of those patterns of thinking and moving. So it's helpful for us as clinicians, but also for the patient.
And we have an example video with our coworker, Dr. J, with a patient. I currently have a patient where this tool is going to be perfect for her. She's a competitive collegiate athlete with cross country. Unfortunately, has had a small fracture that she was unaware of in her ankle, and she's really concerned. Like, I really want to participate in preseason. How am I going to run those distances? I was like, well, in the preseason training or the summer training, we're going to be able to train you at less impact, so we can allow, everything to heal and just kind of keep that coordination that Miriam was talking about.
And also, one more thing before the video too, this can also be helpful for people that aren't even training.
Yes.
Like if you just don't feel great running, this just anecdotally feels much better.
Yeah.
You're significantly lighter. So just there's not the compression. And after having a baby, your body feels like weird.
Yep.
It
like
feels
it's not your own.
Yes. So sometimes just having a little like levity in the system can really help. So even if you don't have a goal in mind to train for something, this just is a really helpful tool just to have you enjoy the process of exercising.
Yeah, and we've used it for not only runners, but just people that have any balance or walking issues. So it's been an amazing treatment tool. As you can see, Dr. J is getting some information on the computer screen, and there's, again, videos there. We can also see the runners or the patient's feet, so we can even make a visual analysis on the phone. And all this information we'll document and, so we can track the progress and treat accordingly. Sorry. Okay, there we go. All right, so without further ado, we were talking about, okay, what are the criteria? What are some things that I am ready? So Dr. Michelle and I have put together a Ready to Run 101 program. It's kind of a couch to 5 program plus. We're 2 physical therapists. Again, all of us are Run DNA certified in terms of like running analysis. A comprehensive runner's evaluation is another thing that we offer. So even if this is something that you're like, okay, I can do all these things, but I really feel like I still need to improve my running. So I have another video that will kind of go through the criteria. Again, there's some extra ones postpartum, like, okay, like a common symptom is like if you're having any leaking or like, bowel movements and stuff that when you really shouldn't. And so that's something like, yeah, you can do these things, but you want to make sure that you don't have any of those other things. So alignment here is important. Like we talked about previous injuries. In soccer, I have knee and ankle injuries, and so just being aware of alignment, and that's something that we can also screen and kind of get feedback about. So again, kind of making sure like the space between the knees stays fairly consistent, like you can still see light through it. That's called a knee window. Making sure the knee tracks over the ankle, that you're not leaning too excessively forward or backwards when you have good stability. There we go. Okay.
So I just wanted to go over the program a little bit. So Michelle and Lauren have worked tirelessly on this. It's been a labor of love, and it's really like covers A to Z of a runner. I think oftentimes people like find a running program like in a magazine or online, and they're like, this seems great. So this is that times 10,000 more parcels of information. So it covers couch to 5K and plus, so longer distance races. Also gives you a training module. It gives you the strengthening, the mobility parts of it, but it also gives you a person who's very knowledgeable and a guide to your running program. That's what those other programs lack. It's not a person to talk to, and the blips that come up or any questions you have, they're the most knowledgeable about this.
Yeah.
It's a great program.
Yeah, I mean, Miriam said it 100% correct. So like, we noticed there was a need, and similar to the population we're talking about today, runners come in, they're like, oh, I did this 5K and now I'm hurt and, not sure what went wrong, but I'd love to do another one. And, there's more 5Ks coming up, or they're all, have been happening. And so we're just seeing more people come in. So again, it's just like it really takes the thinking out of it, where you have someone that's like, I could give you the books to, know all this information, and you could take the, the graduate school and do all of that. But it's like, I've done it for you. We've done it for you. And so that way it just makes it very simple, easy to use. And it just comes with a lot of extra things that you wouldn't get like online. So if you do want more information, about that, just go to runbetterwithpt.com, or again, email us at hello@betterwithpt.com.
So to kind of finish up, picking the right team is basically the umbrella message that we want to tell everybody that's listening here. So the internet search is a good start, definitely not the finish. It might give you some buzzwords to use or something that you may say, oh, I think I might have that. You might or you might not, but it gives you an idea of where maybe to discuss further or look into further. Potential misinformation and misrepresentation is huge, or unfair expectations. So the bounce back mentality after you have a baby, no matter how long after you have a baby, no one knows your life or walked in your shoes. So there's a lot of reasons why you may need to take things slower or faster or progress in a pattern that might be different from your next door neighbor who just had a baby. It takes a village. It's huge. Building that team of the doctor that you trust, PTs, moms, Facebook groups that are supportive. And I think the biggest message is be collaborative, not competitive. So you're comparing yourself only to you. And also to compare yourself before you had a baby to after is not really the same you. You're really different. All the demands of your days are different. Your body's significantly different. So really learning about what changes occurred while you were having a baby, after you had the baby, and then learning how to address some of those changes and focus on progress and not perfection can really help to get you to where you want to be, whatever race you want to be or however you want to train.
Yeah, I mean, I think those are the biggest takeaways for sure. I mean, obviously there's lots of information in this webinar and stuff. So it's just one of those things, you know. So again, it's one of those things that it's just really important to, kind of get in the right headspace and, know exactly, what you're working with and how to progress and stuff. So again, kind of going back to those 5 just to review. Okay. So again, we went over the body changes in running and how they affect running. So again, your muscles and joints are, compromised in certain ways, and just being aware of these and that why strengthening is really important. And just your body's capacity is affected, or what you can tolerate because of all the hormonal changes and lack of sleep. Criteria is important over timeline, and just consider how your old injuries might come back and what are some common new injuries from just having a baby. So there's lots of things you should do before you start running. So again, looking more at the criteria, check yourself out or have a PT look at you. I think it's just important, even if your OB clears you, just to have at least one appointment, whether it's a physical therapist or a pelvic PT.
Just a baseline check.
Yeah, exactly. And
How to check
we
yourself
did
for
that
gas.
video already. Again, look at your posture, make sure that that everything's aligned appropriately so you can tolerate impact. Make sure that you have that strengthening program, a good running plan, and good recovery tools. The Alter G is a wonderful tool, and then those criteria that we talked about in terms of being ready to run. So Miriam, what are some other questions? I'm going to look at the chat and see if we have anything here. Okay, so hi Maya. So she says, I have a 1-year-old and always tend to hold him on my hip and I lean on that side. Could that be contributing to my back pain? Okay, so yeah, that's a wonderful, and Miriam had touched upon that earlier, and that, there's certain ways that we can even help you. Okay, like even if bringing the bag or even the child a little bit more forward, and even just using your opposite arm to brace your elbow, just little things like that can make the weight more symmetrical. Yeah. So even we're going to address, like, from here on out, like when you're holding your child, how to make that more efficient and prevent you from having
and not even
pain.
holding your child, often like lowering your child, picking your child up. Yep. There's always usually like a asymmetry, and that's everybody, not even someone that's injured or not. You have a dominant hand, so you typically move to your dominant hand, but over time that shifts the weight all the way over to that side, hence why someone might have back pain, because they're just getting more compression. So like Lauren said, bringing it to the center, learning different ways of moving, adopting new patterns of movement, that can always help with back pain, and address other things that might have come up along the way that you weren't aware of.
And then this is another great question. Do you have any recommendations for proper running shoes? So again, like that's based on the individual. Like the only thing that research has found to have in terms of an efficient running shoe is it comfortable or not, which is kind of like a no-brainer, but also like, oh, like enlightening, because, you know, there's certain trends with shoes, or you notice certain competitive runners wear a certain type of shoe, but it really has to be comfortable for you, and you know your foot is unique, and so and how you run and stuff. So just making sure that again you have like another person on your team, you know, whether it's a physical therapist or like a running shoe store.
And we can always help you. So we, you know, I think throughout working as a PT in the beginning, like as a PT, you're always like, I think this brand is the best, just because you want to kind of give someone an answer. Just it's the same question with the pillow, like what pillow should I use? And it's really best for you. So coming in here, we can help to identify what type of sneaker would be best for you. Like if you tend to be more flat-footed or have a higher arch, or you tend to have bow legs, or maybe more of a collapsed positioning. So there's a type of shoe that might be best for you to support your body type and the activities you're doing. And that's why a guide, picking the right PT, the right physician, can help you to identify some of those things and kind of guide you to the right shoe, not this type of shoe and all those things.
And we talked about the information overload. So even though this was just about 30 minutes, I'm sure you're also like kind of a little overloaded. So we do offer complimentary 30-minute screenings. And so if you want to schedule that, just give us a call. I'm going to put the phone number here, and it's down at should come up down at the bottom. Show. Okay, it's not. Oh, there it goes. Okay, it's 973-270-7417, and we can schedule an appointment, just because, again, that will make it more appropriate specifically for you. Right. Again, we mentioned various demos, whether it's even just like, hey, I want to try out the Ultra G. So that might, or the boots, yeah. So, I mean, I think definitely letting the front desk know exactly what you want. Yeah, so that we can accommodate for the time to do that. That was a great question. So do you want to take this last one, Miriam?
Sure. So the question is, can you help me find new stretches to do before and after my runs? Absolutely.
So Miriam had done a wonderful webinar about flexibility, and so I highly recommend checking that out. We do have a YouTube channel. Again, if you have trouble finding it or going to our Facebook page, that's a great resource. We have all our webinars on there for the most part, and so that's why I wanted you to take this, because it was wonderful.
So absolutely. So we have, like Lauren said, we have all of this free information that's out there for you to start reading and consuming on your own. But coming in here for the complimentary screening really is more individualized and specific to you. So the stretches that you may need for your runs might be different for someone that just started running or has been running for a long time. In fact, it might not even be stretches you need. It might be mobilization techniques, which is like a nuance of stretching. So oftentimes people think, oh, I just need to like really stretch my hamstrings or stretch my calves. It might be that and some mobilization techniques. Which is an example of the hypervolt or some of the other things we offer, foam rollers. So the complimentary is exactly that. It's no cost to you, but it gives you a tremendous amount of information to arm yourself with for things that would support the activity you want to do and make you feel better doing it and help you do it for much longer.
Yeah, and we're a team. I think a lot of times, personally, I worry about like taking some me time and like how much time I can actually dedicate to that. So even if like you come in, you're like, you really should have a plan of care where you're coming in regularly. If you're like, I really can't do that, then it's something like, okay, well, we could do a 1 month follow-up or something like it's about what your needs are just to get you better. I mean, and not only have you feeling better and doing the things that you love, but also just learning the tools like, oh, if I'm having this issue, I know what to do now. So I think we're really motivated. That's why we became physical therapists and why we did this webinar.
Arming you with like a regimen of, okay, so this popped up. I know that I need to do this and have a schedule and a pattern of things that have worked before so that when it comes up, because inevitably runners get injured. We've had discussions in clinical meetings where there's like an expectation that there might be some injuries that pop up, but knowing how to deal with them and having the tools to address them quickly so they don't like kind of snowball into something bigger, that would be great for a runner. And that's why we're here.
Awesome. Well, we'll let you guys get back to your Wednesday activities. Thank you so much again to Morris Sussex Sports. And again, it seems that we had a little bit of technical difficulties with the images. So if you want to see any of these videos, again, just shoot us an email or give us a call. Again, that's 973-270-7417, or just stop by. We're in the Madison YMCA.
Have a nice day.